Speaker is Dr. Nimrita. No, no. This one also. Last one. No, they will total from here. No, they will do this one. They, no,
It is not playing, ma'am. 1 minute.
अच्छा नहीं slide नहीं आ रहा what they will do they will only go through this and they will
Has
decide
Dr. Meghna Ganesh come?
पता नहीं.
Doctor
Good morning, everyone. My topic for paper presentation is comparison of surgical outcomes of Gatt combined with Phaco in mild, moderate, and severe open-angle glaucoma. I have no financial disclosure. The diagnosis of primary open-angle glaucoma remains really challenging as the early stages of disease are usually not symptomatic. The trabeculectomy is considered the gold standard treatment, but it is often associated with vision-threatening complication. Recently, minimally invasive glaucoma surgery has drawn more attention due to its conjunctival sparing, good safety profile, and quick recovery. We have seen the promising outcomes for mild to moderate glaucoma, but the literature is limited on advanced glaucoma. The aim of a study was to assess the surgical outcomes of Gatt combined with Phaco in POAG based on severity. This was a prospective interventional study. Gatt Phaco was done in 265 eyes. Mild moderate eyes were 144 eyes, and severe included 121 eyes. Written and informed consent was taken. POAG was diagnosed in the presence of open angle on gonioscopy with pre-treatment IOP greater than 21 with optic nerve head damage. HFA using CETA standard 24-2 and 10-2 was done in all patients, and patients were stratified into mild, moderate, and severe glaucoma. Data were collected at 2 weeks, 1, 3, 6, and 12 months. Outcome measures were in terms of IOP, AGM, BCVA, complication, and surgical success. Inclusion criteria included patients who were refractory to medical therapy, showing signs of glaucoma severity on visual field testing, could not tolerate medical therapy, and visually significant cataract. Patients with prior history of ocular trauma or surgery, patients with angle closure and secondary open angle glaucoma, neovascular glaucoma, and on anticoagulant treatment were not included. After routine phacoemulsification, the pyoproline suture was blunted using low temperature cautery. Then nasally 2 mm goniotomy incision was given. Then the suture was threaded along the Schlemm's canal, and 360-degree trabeculectomy was completed. Coming to results, this was a statistical analysis. The sample size was calculated with a 5% level of significance, and the estimated sample size per group was calculated 121 eyes. The success criteria was defined as follows. Complete success included 2 criteria. Criteria 1, IOP greater than 5 and less than or equal to 18 mmHg and 25% reduction from baseline without AGM. Criteria 2, IOP greater than 5 and less than or equal to 15 and 30% reduction from baseline without AGM. Qualified success was defined achieving success with AGM, and failure were defined who were not met the criteria for success or requiring any additional glaucoma surgery. These are the demographic characteristics, and the baseline IOP in mild to moderate group was 20.4 mmHg, and in severe it was 21.46 mmHg. In mild to moderate group, the IOP reduced from 20.40 mmHg to 12.44 mmHg, and in severe it reduced from 21.46 to 12.49 mmHg. There was 31.7% and 38.5% IOP reduction in mild, moderate, and severe group by the end of 12 months. Coming to AGM, in mild moderate, it reduced from 1.35 to 0.08, and in advanced from 2 to 0.13. At the end of 12 months, 92.3% and 89.5 and 89% were medication free in both the groups. There was a significant reduction in BCVA in both the groups by 12 months. This is a line graph showing the average IOP and number of AGM over the visits. Coming to cumulative probability of overall success by using criteria 1, in mild to moderate it was 83.9% and in severe it was 85.8%. By criteria 2 it was 72.1 and 72.4 in mild, moderate and severe group. This is a KM plot showing the success criteria by using criteria 1 and 2. Coming to complication, there were 18 and 12 patients in mild to moderate and severe group had IOP spikes. 26 and 32 patients in mild to moderate and severe group had microhyphema, and AC wash was done at the rate of 1.8%, with 3 being in severe group and 2 in mild to moderate group. Coming to discussion, this for managing the advanced glaucoma stage patients, there should be a holistic approach by considering to lower the IOP to low teens and choosing the safest surgical procedure. By the means of mix, we can achieve this. There are follow-up ranging from 2 year to 4 year, and Magacho et al. Reported the outcomes of Gatt depending on the severity and showed good favorable success. And in other study, Zetam et al. Showed the outcomes of Gatt in moderate to advanced glaucoma. Nirbor et al. Showed a significant IOP and AGM reduction by the end of 6 months. Our study is done in Indian population, and there was significant reduction in IOP and AGM with good comparable success in both the groups. The limitation included shorter duration of follow-up and visual field was not analyzed. To the best of our knowledge, this is the largest cohort study showing the outcomes of Gatt depending on the severity. To conclude, it is a safe and good procedure with relatively minimal complications. Thank you.
Thank you, Dr. Nimrita. Any question, anyone?
Were all the surgeries done by the same surgeon?
Yeah. Single surgeon by Devendra Maheshwari.
So with the permission of the chair, may I make one comment on the entire session? So one comment is that all of you all are presenting data on patients and not one slide said informed consent except probably hers. So you have to have informed consent when you're talking of that. None of you have ethical clearance. So when you're in the academic world, you have to have ethics. So none of you had a slide on ethics. And third, none of you had a slide on financial disclosures. So you had one? Okay. Nobody else had. And the other thing is, I also want to bring in mind that since this is a mixed session, the outcome measure by the American Academy now for MIGS is a reduction of AGM by at least 1 with the same IOP. And you have to have that outcome in. So in context, if you have 15 millimeters of mercury on 5 drugs and 15 millimeters of mercury on 1 drug, that is a success. But according to your outcomes, it won't qualify for it. So remember that. That's the only comment for a mixed session.
Thank you, ma'am. Thank you.
Thank you. And thank you, Susmita ma'am, for the input.